Hey everyone, I'm on off like a light switch. I'm a third year medical student. I just wanted to talk about briefly the COVID-19 pandemic that's been going on. It's all over social media, it's all over YouTube. Everyone's talking about it and it's been affecting it day-to-day life now, like on a global scale. Why not give my perspective of what's going on and how we should handle things? Just want to emphasize that I'm not an expert, I'm not an epidemiologist or an infectious disease specialist. I'm a medical student. My knowledge is coming mainly from the experts, like the CDC and World Health Organization. What is COVID-19? COVID-19 is the novel coronavirus that was seen first in humans in 2019. And then some symptoms that you may experience if you do get this condition, you do contract the virus, is pretty vague and it's overlaps with other conditions. So you get a fever, you can get a cough, shortness of breath, difficulty breathing. It overlaps with the flu and other common cold, upper respiratory illnesses. So whether or not this is actually coming from COVID-19 is questionable. Who is at high risk? So the people that are at high risk are usually the elderly. Older people above 60 years old, people who have a compromised immune system, whether they're on immunosuppressant medication or they have disease that compromises their immune system, cancer, or even people who have pre-existing medical conditions like diabetes, heart disease. If you're young and healthy, you're probably not as high risk as those individuals that I mentioned, but you might think that, oh, I don't need to worry about this because I'm young and healthy. I don't mind getting the condition. I don't mind getting the virus. I'll be fine. That might be the case. If you do get the virus, it'll probably be mild. But the problem is that you're putting other people at risk if you do contract this virus. And in general, you don't want to do that. And you just don't want to get sick in general, because being sick is not the best thing. It's pretty sucky and it's going to impair your quality of life. And you're going to be like, oh, I wish I was healthy. Yeah, you get to probably miss school or work. That's not good. You want to keep on going with your day-to-day life. Don't think about it that way. What is the treatment for COVID-19? It's actually supportive. There's no vaccine, there's no cure for it at this time. Anti-fever medication, increasing your fluid intake, so being sure you're hydrated, eating properly. Just make sure that your body is getting the nutrients that it needs. And don't go overboard with like vitamin C or any other supplements. Too much of anything can be bad, too little of anything could be bad. Make sure you have a nice healthy balance of everything. And can you get antibiotics for this? No, you can't. This is a virus, not a bacterial infection. So if it was a bacterial infection, antibiotics could be useful. But because this is a virus, antibiotics are not useful. And then I saw some interesting studies that there's a anti-malarial drug called chloroquine and zinc that could be potentially effective at fighting this infection, fighting the virus, but there needs to be more studies about it. So why is it important we take preventative measures? Well, here's a CDC diagram from the Harvard Medical School website showing the impact it has on the healthcare system. Protective measures such as limiting travel, avoiding crowds, social distancing, and thorough and frequent hand washing can slow down the development of new COVID-19 cases and reduce the risk of overwhelming the healthcare system. What can you do to prevent yourself from having the virus or getting the disease? Proper hand hygiene. You don't want to be shaking hands. You don't want to be coughing and sneezing. If you do, make sure to cover it with the inside of your elbow, tissue. Just don't spread it. At this time, it's known to be a droplet transmission. So like liquid secretions like sneezing, coughing. It's not airborne at this time, as far as we know. There's no evidence for that. So wearing a mask, and this is not something to be really worried about. You want to wash your hands, keep soap and water for 20 seconds. That's the best thing you can do, and don't be in close contact with people that are sick. And if you're sick, just stay at home. Don't go outside and spread it to other people, because the best thing to do is to prevent this infection from spreading. Other thing, don't touch your eyes, don't touch your mouth, don't touch your nose. So this area, just don't touch your face. It's a habit, and avoid it as much as possible. Avoid crowded places if you can. You don't want to be putting yourself at risk. And if you think you have the virus, you should try to get tested, but there's a criteria that you have to meet for it. The CDC actually puts a criteria out here on their website, knowing the signs and symptoms. Like I mentioned before, if you have a fever, you have a cough, shortness of breath, pretty vague, but get some medical advice, go seek like a health professional. And they say that if you also have been in close contact with someone to have known contracted COVID-19 or live in the area where it's been going on, like where the ongoing spread is, and call ahead of time, just let them know, give them a heads up in the doctor's office or the emergency room, and tell them about your travel history and your symptoms. There's not that many kits going around. I'm not sure if there hopefully will be more kits available to the public for doctors to get people tested. But at this time, that's something I'm not really entirely sure about. The test is a PCR test. It's a reverse transcriptase PCR polymerase chain reaction test. Is it okay to panic? No, it's not. Don't panic. This is not something to be scared about, but it's something to be cautious about. You got to be alert, nothing too overboard and go out and stock up as if this is an apocalypse. That's hopefully not going to be the case. But buy things that you need, when you're going grocery shopping. Don't go overboard and don't buy things that you don't need or don't think are necessary. It seems that this has definitely impacted our way of life dramatically. I never thought this would happen. Schools are being closed for a longer period of time. Religious organizations are stopping group prayers. As a third year, I'm going through rotations in my medical school education. I'm actually on my surgery rotation right now for a couple of months, and one of the hospitals is limited on sterile gowns. So as a student, to go to this hospital for their surgery rotation, if you're there, you can't actually scrub in. It's mostly observation. So it affects your experience as a student. We're not allowed to take care of any patients with COVID-19. The medical field is an interesting field. You're going to be exposed to people that have infectious conditions, and you're putting yourself at risk, but this is for the sake of taking care of other people, and you just have to take the necessary precautions for it. If you're in a different field, it's obviously not the same case, but because as a future doctor, or even when you're a doctor, you're going to be having to take care of patients no matter what they have. You will just have to deal with it accordingly. We're still going through the rotations right now. As far as I know it, unless something changed, we'll see. And people are going to continue to get infected, and the best thing to do is stay cautious, not feel the hysteria, the panic, the fear. It's not going to do anybody any good. It's just going to make things worse. We should try and prevent the spread of the virus for the sake of everyone. We don't want this getting any worse than if we can help it. Thanks for listening. I hope you all stay safe and healthy.